On today's Two on Your Side Town Hall, more vaccines, but also more cases and more hospitalizations. We're going to take some time to talk about where things stand right now here locally with the pandemic, with some troubling trends popping up.
Plus, we debunk one of the most widely spread bits of misinformation regarding the vaccine. You won't want to miss a special report from our Verify team.
And counting down to curtains up, we're going to have a look toward better days, and we'll talk about entertainment venues, when they might be able to reopen, and the financial help that is keeping them afloat just a little bit longer.
And good evening, everybody. More than 770 Western New Yorkers tested positive for the coronavirus yesterday, the most in a single day since January.
Yeah, the trends are definitely concerning. We're seeing that increase in cases, and now that's leading to more and more people ending up in local hospitals. So in the Western New York region, there are now just shy of 300 people hospitalized with COVID-19. And you can see there, it's really been a steady increase dating back to about March 20th. Since then, we've seen hospitalizations for the region double.
And during that same time span, we've vaccinated a lot of people. Statewide, New York just hit 37% of residents with at least one dose, and almost a quarter are now fully vaccinated. Both of those figures are well above the national averages. So you're probably asking, since more and more people are getting protected, why are we still seeing more cases and more hospitalizations? And that is a great question for our first guest. Dr. Brian Murray is the Chief Medical Officer at ECMC. Dr. Murray, thanks for joining us tonight.
You're welcome. Thank you for having me.
Yeah, we really appreciate your time. Before we get to the numbers and really talk about why things are the way they are right now, I wonder if you can first just give us a sense what it's like on the floors at ECMC right now with COVID patients and specifically your intensive care units. You don't have as many patients as back during the big spike early this year, but again, we're now closing in on 300 people hospitalized in our region. Who are these folks and what kind of toll is this taking?
Well, obviously, yes, the numbers are increasing, but they're not as high as they were in January. But obviously, we are hoping that as more and more people get vaccinated, we may see some plateauing and we may not reach the heights we reached in early January. The most remarkable thing about this particular surge is that we are seeing it in a much younger age group. The predominant patients are less than 65. And we're seeing more cases than we've ever seen before in the 19 to 44 age group. As a consequence, the people, although they're hospitalized, are not quite as sick as we saw, for example, back in the first wave a year ago, where it was predominantly older people with a lot of comorbidities. But the one thing is they are virtually all people who have not received vaccine, are not fully vaccinated. And that by fully vaccinated, I mean 2 doses and 14 days after the second dose. Now you do obtain some protection from the first dose of the vaccine, but we do occasionally see patients who've had 1 dose, particularly if they come in within 14 days of the vaccine. Now we don't know if those are infections they contracted just before they got vaccinated or whether the vaccine at that point hasn't really generated enough immunity.
When we talk about what's driving this increase in cases and hospitalizations, how would you classify it? Is it fatigue? Is there some particular source of the spread? Is it the variants that are showing up more here locally now? Is there one thing that you're seeing more than other things, or is it a combination of all these factors?
I don't think at this point we have enough data to pinpoint exactly what's causing this surge, but I think the variants are certainly contributing. The variants we are seeing in Western New York, such as that originated in the United Kingdom and California, and actually today I saw a report that we've now identified the South African variant here. These are much more contagious and much more easily transmissible by about 60%. So they will cause more infections in susceptible people. So on the other hand, this latest increase did occur after some of the relaxation of restrictions that occurred towards the end of March. So that may have contributed. And also people may have thought that as the cases went down in March, the worst was over and that they could relax. And I think that all 3 of those factors have contributed to what we're seeing.
Let's talk about vaccines, and you mentioned this a moment ago, and we showed some of those stats that New York is doing quite well at getting shots into arms, but obviously it can't happen quickly enough as we deal with this uptick in cases and hospitalizations. How long do you think it's going to be until we can get enough people immunized that it actually starts to make a difference in how well the virus is able to spread in the community? We clearly aren't at that percentage yet.
Right. The good news is we have 25% of people vaccinated. The bad news is we have only 25% of people fully vaccinated. Obviously, the vaccines have helped. That's a group of people who are probably immune from developing serious disease, hospitalization, and death from the virus. We need to get that number up much higher before you get the phenomenon of what we call herd immunity. We'd need to be up at about 3 times that number, which is 75%. And that will probably take, at the current rate, another month or 2. So I think as more and more people get vaccinated, we should be seeing some attenuation of this most recent rise.
And Dr. Murray, we're almost out of time, but we are entering a weekend here. We know that people are tired. The weather's supposed to be really nice. And you've really laid out that this virus is still very much a part of our lives. What is your message to Western New Yorkers who may be watching right now?
Well, particularly if you are not fully vaccinated, you should still be observing the social distancing, wearing the mask, avoiding crowds of people that you don't know, and confining yourself really to your closer family. Now, this weekend we should be able to gather, if we do have to gather, outdoors, and it does seem that outdoors is better than indoors. So it's still, unfortunately, the same prescription of social distancing that is really what prevents you getting infection unless you're fully vaccinated.
At least at this point, we know that, right? It's just a matter of practicing it the right way. Dr. Brian Murray is the Chief Medical Officer at ECMC. Thanks so much for coming on the show, and have a great weekend.
Thank you very much for giving me this opportunity. Appreciate it.
Certainly appreciate the perspective. Well, there is a vaccine alert tonight for some cancer patients. Researchers in Pittsburgh did an analysis and found those with cancer affecting their blood, bone marrow, or lymph nodes are at a higher risk of the vaccine not offering as much protection.
Yeah, those scientists issued what they call a cautionary statement, telling those patients, especially those with chronic lymphocytic leukemia, that they should continue wearing masks and practice social distancing even after they're fully vaccinated, as the research continues to see just how well the vaccines are able to protect them.
And we want to share part of the statement that we got from the Chief of Infectious Diseases at Roswell Park Comprehensive Cancer Center here in Buffalo. He agreed that some patients may not mount as strong an immune response, and quote, "At Roswell Park, we've begun a study to evaluate immune responses to COVID-19 vaccines. Keep in mind that even if the immune response to vaccination isn't optimal, vaccination could still offer value regarding reduced likelihood of getting COVID-19 or reduced severity of infection. Therefore, we strongly recommend that patients with cancer receive a COVID-19 vaccine when offered."
Yeah, we bolded that part of the statement. Really important to note there that cancer patients are still advised to get the vaccine just as soon as they can, because they are at higher risk of severe disease if they catch the virus. Well, we talked a lot yesterday about vaccine cards, the pieces of paper that you get from the CDC after you get a shot. The FBI is now out with a warning to people trying to make, sell, or buy fake vaccine cards.
And that is a federal crime. NBC News has found there is demand for the fake cards on the dark web.
What do these cards look like? Do they look legit?
They look very legit. I mean, we know that a lot of the cards that we see are just paper cards, cardboard cards with a simple logo on them, with filled out information with pen of, location, date of birth, name, etc. The cards look very, very similar, if not exact, to what you would get if you were to get a vaccine.
Vicki Wynn's special report on these fake vaccine cards and how they're tied to public health concerns, scams, and identity theft. All of that is ahead on NBC Nightly News with Lester Holt at 6:30.